Think of the last time you laughed so hard your stomach ached. Not a polite chuckle, not a courtesy laugh at someone's joke in a meeting. The kind of laugh that took your breath, bent you forward at the waist, and forced air out of your lungs in convulsions you could not stop. The kind where you tried to speak and could not. Where tears came and you wiped them and they came again. Hold that memory for a moment. Now consider what was happening 3 millimeters beneath the skin of your inner forearm at that exact moment. A single layer of cells lining the inside of that artery was doing something it cannot do during a 5-kilometer run. Your body contains a hidden organ. It is not listed in most anatomy textbooks as an organ, but it meets every criterion. It weighs roughly the same as your liver. If you could peel it off the inside of every blood vessel in your body and lay it flat on the ground, it would cover a surface area between 300 and 1,000 square meters. That is larger than a tennis court. Larger, in some estimates, than 2 tennis courts placed side by side. The human body contains somewhere between 10 trillion and 60 trillion of these cells. Each one is thin, extraordinarily thin. In the capillaries and veins, less than 1/10 of a micrometer thick. In the aorta, roughly 1 micrometer. They are hexagonal, slightly elongated, approximately 50 to 70 micrometers long and 10 to 30 micrometers wide, oriented along the axis of the vessel like tiles laid in the direction of the current. This organ is called the endothelium. For most of the 20th century, the endothelium was dismissed. Anatomists described it as a passive membrane, biological wallpaper. It was there, they acknowledged, but it did not appear to do anything beyond separating the blood from the vessel wall. That was the entire story. They were wrong by a magnitude that is difficult to overstate. The endothelium is not wallpaper. It is a pharmaceutical factory. Every cell in that single-cell layer manufactures, stores, and releases a library of chemicals that determine whether your blood vessels open or close, whether your blood thickens or thins, whether inflammatory cells stick to the vessel wall or slide past, whether the artery beneath it stiffens into plaque or stays supple enough to pulse with each heartbeat for 90 years. It releases vasodilators like prostacyclin and endothelium-derived hyperpolarizing factor. It releases vasoconstrictors like endothelin-1 and thromboxane. It regulates coagulation. It controls the trafficking of immune cells across the vessel wall. It orchestrates the growth of new blood vessels during wound healing. It senses the mechanical force of blood flow against its surface and adjusts its chemical output accordingly. And the most important chemical it produces is a gas. In 1978, a pharmacologist named Robert Furchgott at SUNY Brooklyn noticed something peculiar during an experiment with rabbit aortas. When he applied a drug called acetylcholine to a strip of blood vessel, the vessel sometimes relaxed and sometimes contracted. The same drug, the same tissue, opposite results. The inconsistency should have been a minor frustration, a methodological footnote. Instead, Furchgott traced the contradiction to its source and found something no one had predicted. The difference had nothing to do with the drug. It had to do with whether the inner surface of the vessel had been accidentally scraped during preparation. When the endothelium was intact, the vessel relaxed. When it was damaged, the vessel contracted. The endothelial cells were manufacturing something, releasing it inward toward the blood and outward toward the muscle, and that something was commanding the vessel to open. Furchgott called it endothelium-derived relaxing factor. He had no idea what it was. It took 8 years to find out. In 1986, Furchgott and a pharmacologist named Louis Ignarro, working independently at separate institutions, converged on the same answer at a conference held at the Mayo Clinic in Rochester, Minnesota. The endothelium-derived relaxing factor was nitric oxide, a gas. A molecule so simple it contains 1 atom of nitrogen bonded to 1 atom of oxygen. A molecule so unstable it survives in biological solution for 6 to 30 seconds before hemoglobin scavenges it and converts it to nitrate. A molecule so common it is a component of automobile exhaust and cigarette smoke. and it was the master regulator of blood vessel diameter in the human body. Meanwhile, a third researcher named Murad had been working on a separate problem entirely. He had shown in 1977 that nitroglycerin, the heart drug prescribed to angina patients since the 1860s, works by releasing nitric oxide, which then activates an enzyme called guanylyl cyclase in smooth muscle cells. Alfred Nobel was prescribed nitroglycerin for his own chest pain late in life, an irony he noted with some bitterness in a letter, writing that it seemed like the irony of fate that he had been ordered to take the very substance he had spent his career manufacturing as an explosive. In 1998, Furchgott, Ignarro, and Murad shared the Nobel Prize in Physiology or Medicine for identifying nitric oxide as a signaling molecule in the cardiovascular system. It was the first time a gas had been recognized as a signal between cells in the body. The discovery triggered over 150,000 publications in the 2 decades that followed and led directly to the development of sildenafil, marketed as Viagra, which works by preventing the breakdown of cyclic GMP, the downstream messenger of nitric oxide in smooth muscle. Here is what nitric oxide does in your vessels, step by step. When endothelial cells release it, the gas diffuses laterally and outward through the vessel wall, passing through cell membranes with no resistance, because it is lipophilic, fat-soluble, and small enough to move through biological barriers the way air moves through a screen door. It enters the smooth muscle cells that wrap around the artery in concentric rings. Inside those muscle cells, nitric oxide binds to and activates an enzyme called soluble guanylyl cyclase. That enzyme converts a molecule called GTP, guanosine triphosphate, into cyclic GMP, cyclic guanosine monophosphate. Cyclic GMP tells the muscle cell to relax by triggering a cascade that removes calcium from the contractile machinery. The muscle uncoils. The artery widens. Blood flow increases. Blood pressure drops. The oxygen delivery to every tissue downstream improves. This is vasodilation. It is the single most important protective event in your cardiovascular system, and it depends entirely on the health of that one-cell-thick lining. Now here is where laughter enters the story. When you laugh, your diaphragm contracts. The diaphragm is a dome-shaped muscle that sits beneath your lungs and above your abdominal organs like a parachute stretched across the bottom of your rib cage. During quiet breathing, it moves gently downward on inhalation and returns passively on exhalation. During hard laughter, it does not move gently. It spasms. The contractions are rapid, rhythmic, and involuntary. You cannot stop them once they begin. Each spasm drives downward into the abdominal cavity and then snaps back, forcing air out of your lungs at high velocity through the larynx, producing the staccato bursts of vocalization that constitute the sound of laughter. The abdominal muscles contract simultaneously. The intercostal muscles between your ribs engage. Your face contorts because the motor cortex is firing in patterns that coordinate facial expression with respiratory output. But the diaphragm does more than move air. It sits at a crossroads of the nervous system. The vagus nerve, the longest cranial nerve in the human body, runs from the brainstem down through the neck, past the heart and lungs, through the esophageal hiatus of the diaphragm, a gap in the muscular sheet where the esophagus passes through, and onward into the stomach, liver, pancreas, and intestines. The name comes from the Latin word for wanderer, because it wanders farther from the brain than any other cranial nerve. It is the primary cable of the parasympathetic nervous system, the branch of your autonomic wiring responsible for slowing the heart rate, lowering blood pressure, stimulating digestion, and restoring the body to a state of calm after a threat has passed. Stephen Porges, the neuroscientist who developed polyvagal theory, has described laughter as one of the few voluntary behaviors that simultaneously activates the vagus nerve, benefiting both heart rate variability and overall vagal tone. The vagus nerve passes directly through the diaphragm. Every violent contraction of the diaphragm during a fit of laughter mechanically stimulates the vagus nerve. This is not a metaphor. It is not an indirect psychological effect mediated by mood. The physical movement of a muscle compresses and activates a nerve passing through it. The stimulation is mechanical, immediate, and measurable. This vagal activation shifts your autonomic nervous system toward parasympathetic dominance. Heart rate variability increases. Heart rate variability is the variation in time between successive heartbeats, and it is one of the most reliable markers cardiologists use to assess cardiovascular resilience and autonomic flexibility. Higher variability means a more adaptable heart. Lower variability is associated with increased risk of cardiac events. Sympathetic tone, the constant low-level activation of your fight-or-flight system, drops. Cortisol production, driven by the hypothalamic pituitary adrenal axis, begins to decline. But vagal stimulation from the diaphragm alone does not explain what happens to the blood vessels. That requires a second pathway, one that was not understood until a discovery was made in an entirely different field. In 2005, Michael Miller, a cardiologist and director of the Center for Preventive Cardiology at the University of Maryland School of Medicine in Baltimore, presented results at the American College of Cardiology that would quietly redefine the relationship between emotion and vascular health. He took 20 healthy non-smoking volunteers, 10 men and 10 women, average age 33, with normal blood pressure and normal cholesterol, and showed them 2 films on separate days with at least 48 hours between viewings. One film was a comedy. The other was the opening battle sequence of Saving Private Ryan. Each volunteer served as his or her own control. Before and after each screening, Miller's team measured the diameter of the brachial artery, the main vessel running from the shoulder to the elbow, using high-resolution ultrasound and a technique called flow-mediated vasodilation. The volunteers fasted overnight before each measurement. Baseline readings were taken. Then the film played. Then the measurements were repeated. After the stressful film, brachial artery flow decreased in 14 of 20 subjects. Average blood flow dropped by 35%. The endothelium constricted. Blood vessels narrowed. This was expected. 2 decades of prior research had established that psychological stress triggers vasoconstriction through sympathetic nervous activation, elevated catecholamines, and endothelial dysfunction. After the comedy, blood vessels dilated in 19 of 20 subjects. 19 out of 20. Average blood flow increased by 22%. The difference between the 2 conditions, combining the expansion from laughter and the contraction from stress, produced a 30 to 50% swing in blood vessel diameter measured across more than 300 individual readings. Miller described the magnitude of change he observed in the endothelium after laughter as consistent with the benefit typically observed from aerobic exercise or statin therapy. He was careful with this comparison. He did not say laughter was equivalent to running or to taking a pill. He said the magnitude of endothelial change, the measured shift in flow-mediated vasodilation, fell within the same range, the same tissue, responding to a completely different stimulus, producing a vascular shift that overlaps with what pharmaceutical intervention or sustained physical exertion achieves. Here is what Miller openly acknowledged his study could not determine. He measured the effect. He did not identify the pathway. Was the vasodilation coming from the mechanical action of the diaphragm? From a neurochemical release triggered by the emotional experience of humor? From some combination of pathways no one had yet mapped? He speculated publicly that nitric oxide was involved, and that endorphins might play a role. But the specific mechanism connecting laughter to endothelial dilation was at that point a hypothesis. The mechanistic answer had actually been published a decade earlier. In 1995, George Stefano and Michael Goligorsky at the State University of New York at Stony Brook, working with a team that included Thomas Bilfinger, Herald Magazine, and others, published a paper in the Journal of Biological Chemistry that changed the architecture of endothelial pharmacology. They had been studying the known blood pressure lowering effects of morphine when they hypothesized that endothelial cells themselves might be a target of opiate signaling. What they found exceeded their hypothesis. Human arterial endothelial cells and rat microvascular endothelial cells contained a high affinity, saturable opiate binding site, an opiate receptor sitting on the surface of the cells that line the inside of your blood vessels. This was not the classical mu receptor found throughout the nervous system. The binding site was sensitive to opiate alkaloids, but insensitive to opioid peptides like the enkephalins that activate classical mu receptors. Stefano designated it mu3. It had a unique pharmacological profile, and when activated, it did one thing with extraordinary specificity. It triggered the endothelial cell to release nitric oxide. The coupling was demonstrated directly. Morphine applied to endothelial cells and to rat aortic rings in culture induced nitric oxide production. The response was blocked by naloxone, an opiate antagonist, confirming receptor mediation. It was blocked by nitric oxide synthase inhibitors, confirming that the nitric oxide was being produced enzymatically. Opioid peptides did not produce the same effect, confirming the mu3 specificity. Opiate binds mu3 receptor. Mu3 receptor activates endothelial nitric oxide synthase. Endothelial nitric oxide synthase converts L-arginine to nitric oxide. Nitric oxide diffuses into the smooth muscle. The vessel relaxes. Now consider what laughter does to your neurochemistry. When you laugh with genuine engagement, the kind of laughter that recruits your whole body, your pituitary gland releases beta-endorphin into systemic circulation. Beta-endorphin is a 31 amino acid peptide cleaved from a larger precursor protein called propionmelanocortin. It is the most extensively studied endogenous opioid, the molecule most closely associated with exercise-induced euphoria, with the analgesic response to acute stress, with the social bonding that follows shared physical experience. Robin Dunbar's research group at the University of Oxford demonstrated using PET neuroimaging that social laughter triggers endogenous opioid release in the brain, confirming the link between mirth and the opioid system at the neurological level. And beta endorphins have high affinity for opiate receptors, including the mu3 variant. This is the mechanism Miller's ultrasound study could not visualize. Laughter triggers beta-endorphin release from the pituitary. Those endorphins circulate through the bloodstream, reaching the inner surface of every vessel in the body within seconds. They encounter the mu3 opiate receptors on the surface of endothelial cells. They bind. The receptor activates. Nitric oxide synthase engages. L-arginine is converted to nitric oxide. The gas diffuses into the smooth muscle. Cyclic GMP rises. The vessel dilates. The entire vascular system responds to the chemical signature of genuine joy. Now here is the distinction that makes the title of this script precise rather than hyperbolic. Exercise releases beta endorphins. This is well established. But exercise simultaneously activates the sympathetic nervous system. Heart rate climbs. Blood pressure rises. Peripheral vessels constrict to redirect blood flow from the skin and visceral organs towards skeletal muscle. Catecholamines, epinephrine and norepinephrine, flood the circulation. The endorphin release from exercise arrives in a vascular environment dominated by sympathetic vasoconstriction. The net effect on the endothelium is the arithmetic of two opposing forces. The endorphin is pushing the vessel open through the mu3 nitric oxide pathway. The catecholamine storm is pulling it shut through alpha-adrenergic receptor activation on the smooth muscle. Both are happening at once. The endothelium gets both signals simultaneously. Laughter does not create this conflict. A brief spike in heart rate occurs during the laugh itself, lasting seconds. Then, the parasympathetic system takes over, boosted by the direct vagal stimulation from diaphragmatic contraction. Sympathetic tone drops. Catecholamines fall. The endorphin release arrives in a vascular environment that is already shifting toward relaxation. The mu3 receptor activation meets no competing vasoconstrictive signal. The nitric oxide release acts unopposed on the smooth muscle. That is what exercise cannot replicate, not the endorphin release itself. The vascular context in which the endorphin arrives. The cascade continues past the vessel wall. Lee Berk, Associate Research Professor and Associate Director of the Center for Neuroimmunology at Loma Linda University School of Medicine in California, has been measuring the systemic effects of laughter since 1988. His research, conducted in partnership with Stanley Tan at the same institution, represents the most comprehensive longitudinal investigation of laughter's neuroendocrine and immune consequences in the published literature. In a series of 5 studies involving 52 healthy men, published in the journal Alternative Therapies in Health and Medicine in 2001, Berk's team drew blood at 4 time points: 10 minutes before the subjects watched a 1-hour comedy video, 30 minutes into the video, 30 minutes after it ended, and 12 hours later. The hormonal shifts were not subtle and they were not transient. Cortisol, the primary glucocorticoid stress hormone produced by the adrenal cortex, dropped by 39%. Epinephrine, the catecholamine that drives the acute stress response, fell by 70%. Beta endorphin levels rose by 27%. Growth hormone, a peptide that plays a role in immune regulation and tissue repair, climbed by 87%. But the immunological data is where the study becomes difficult to dismiss. Natural killer cell activity increased with statistical significance. Natural killer cells are large granular lymphocytes that constitute roughly 5 to 15% of circulating lymphocytes. They kill virally infected cells and tumor cells through direct cytotoxicity without needing prior sensitization. They detect targets by the absence of MHC class I molecules on the cell surface, a molecular signal that something has gone wrong inside the cell. When natural killer cell activity goes up, your body's first-line surveillance against both infection and malignancy becomes more aggressive. Laughter made that system more active. Gamma interferon rose and remained elevated 12 hours after the laughter ended. Gamma interferon is a cytokine produced primarily by natural killer cells and T lymphocytes. It activates macrophages, enhances antigen presentation, and plays a central role in the adaptive immune response. Immunoglobulins A, G, and M all increased. Activated T cells increased. B cells increased. Helper T cells increased. Helper to suppressor T cell ratios improved. The effects on leukocyte subsets persisted 12 hours into recovery. Half a day of measurable immune enhancement from 60 minutes of comedy. Berk's later research extended into the brain itself. Using electroencephalography, his team demonstrated that humor and laughter produce increased gamma wave band frequency, oscillations between 31 and 40 Hz, across multiple brain regions simultaneously. Gamma waves are the highest frequency brain waves measured by surface EEG. They are associated with heightened information processing, improved memory consolidation, and enhanced neuronal synchronization across distant brain areas. The same gamma band activity is observed in experienced meditators during deep contemplative practice. Laughter produces it spontaneously. The brain during genuine mirth enters a state of coordinated high-frequency processing that mirrors the neural signature of focused meditation, without requiring training, without requiring discipline, without requiring silence. It requires only something funny enough to break through. And the cortisol reduction feeds directly back into the endothelial mechanism. Chronic cortisol exposure damages endothelial cells. It impairs their production of nitric oxide. It upregulates the expression of adhesion molecules, intercellular adhesion molecule 1 and vascular cell adhesion molecule 1, on the endothelial surface. These are the molecular handles that allow circulating monocytes and LDL particles to grip the vessel wall, burrow beneath the endothelium, and begin the inflammatory cascade of atherosclerosis. Every sustained drop in cortisol removes pressure from that process. Every removal of pressure is a window during which the endothelium can restore its own protective chemistry. The mechanism chain, then, is not a single event. It is 4 simultaneous processes converging on the same one-cell thick tissue from 4 different directions. Diaphragmatic spasm stimulates the vagus nerve. shifting autonomic balance toward parasympathetic tone and improving heart rate variability. Beta-endorphin release activates Mu3 opiate receptors on endothelial cells, triggering nitric oxide synthesis and direct vasodilation through the cyclic GMP pathway. Cortisol and epinephrine decline lifts a chemical siege from the endothelial surface, restoring its capacity for constitutive nitric oxide production. Immune upregulation, particularly gamma interferon and natural killer cell activation, provides anti-inflammatory protection to the vascular wall from the circulating blood side. No single pharmaceutical intervention activates all four pathways at once. A word about what we know with confidence and what remains uncertain. The vasodilation data from Miller's group is robust. The studies have been presented at both the American College of Cardiology and the European Society of Cardiology. The magnitude comparison to aerobic exercise and statin effects on endothelial function is based on measured flow-mediated vasodilation values that fall within overlapping ranges. The underlying mechanism, nitric oxide-mediated relaxation of vascular smooth muscle, is the same pathway that earned the 1998 Nobel Prize. This is strong evidence with a clear physiological explanation. Berk's neuroendocrine and immune findings are consistent, statistically significant, and biologically coherent. They come from controlled laboratory conditions using validated biomarkers. The limitation is population scope. The subjects are predominantly healthy men. The sample sizes are in the dozens, not thousands. The critical clinical question: does a lifetime of regular, genuine laughter reduce the incidence of myocardial infarction, stroke, or cancer, has not been tested in a prospective randomized trial. The direction of every measured biomarker change is protective. The magnitude of the changes is clinically meaningful. The long-term epidemiological proof is absent. Stefano's Mu3 receptor work is demonstrated at the cellular and tissue level with rigorous pharmacological controls. The receptor exists. The coupling to nitric oxide is direct. The endorphin receptor nitric oxide chain is a legitimate molecular pathway. What has not been quantified is the proportional contribution of this specific pathway to total endothelial nitric oxide output during a real laugh in a living person, as distinct from the vagal component, the cortisol withdrawal component, and other parallel signals. The vagal mechanism has the broadest independent support, connecting to decades of research on diaphragmatic breathing, respiratory sinus arrhythmia, and cardiac vagal tone that extends far beyond laughter studies. So confidence should be layered. Laughter dilates blood vessels through endothelium-dependent mechanisms. This is measured, replicated, and mechanistically explained. The hormonal and immune cascade occurs reliably in controlled settings, with every change pointing toward vascular protection. The specific molecular pathway through Mu3 receptors and endothelial nitric oxide is demonstrated in cell culture and is biologically consistent with the observed vascular effects. The definitive prospective trial linking laughter to reduced cardiovascular mortality does not exist. The biology converges. The clinical proof trail remains incomplete. Consider what you would pay for a pharmaceutical that does the following: increases blood flow by 22% through endothelium-dependent vasodilation, reduces cortisol by 39%, cuts circulating epinephrine by 70%, raises beta-endorphin levels by 27%, boosts natural killer cell activity and sustains elevated gamma interferon for 12 hours, increases heart rate variability, improves vagal tone, operates through the same nitric oxide signaling cascade that 3 scientists received the Nobel Prize for characterizing. Such a drug partially exists. It is called nitroglycerin, and it has been prescribed for angina pectoris since 1867. It works by donating nitric oxide directly to vascular smooth muscle, bypassing the endothelium entirely. Alfred Nobel was prescribed it for his own heart disease, a fact he regarded with dark amusement given that his fortune came from the explosive form of the same chemical. Nitroglycerin relieves chest pain within minutes. It saves lives during acute myocardial infarction. And it does exactly one thing. It provides exogenous nitric oxide to one target tissue. It does not reduce cortisol. It does not modulate immune surveillance. It does not stimulate the vagus nerve. It does not raise endorphin levels. It does not activate natural killer cells. It does not sustain gamma interferon elevation for 12 hours. It pushes one lever in a system that has dozens of levers, and it pushes that lever from outside the body. Statin therapy, the other clinical intervention whose endothelial effects mirror compared to laughter, costs several hundred to several $1,000s per year depending on the formulation. Statins improve endothelial function through LDL reduction and through pleiotropic anti-inflammatory effects on the vessel wall. They are among the most prescribed and most evidence-backed medications in the history of cardiovascular medicine. And they too act through a narrow band of the pathways that a genuine, uncontrollable laugh engages simultaneously. Here is where the honesty must be precise. 15 minutes of hard laughter is not equivalent to a sublingual nitroglycerin tablet during an acute coronary event. It is not a substitute for rosuvastatin in a patient with familial hypercholesterolemia and an LDL of 200. The dose is different. The clinical context is different. The comparison is not about substitution. It is about molecular identity. The nitric oxide pathway that laughter activates in the endothelium is not analogous to the pathway that nitroglycerin activates. It is the same pathway, the same enzyme, the same second messenger, the same smooth muscle response. Your endothelium does not distinguish between nitric oxide released by a pharmaceutical dissolving under the tongue and nitric oxide released by its own receptor responding to an endorphin that arrived because a friend told a story so absurd you could not breathe. The concentration is different. That difference matters clinically. But the identity of the molecule and the pathway it travels is not approximate. It is exact. The person who is 67, who had a stent placed in the left anterior descending artery 4 years ago, who takes a daily aspirin and a statin and a beta blocker and an ACE inhibitor and checks blood pressure every morning with a cuff on the kitchen counter before coffee, who was told to walk 30 minutes a day and did it faithfully for the first year and now manages 3 times a week on a good week, less when the weather is poor or the knee acts up, who was told to reduce sodium and did, mostly except when eating out, who was told to manage stress and nodded and meant it, and has no practical idea what that instruction looks like on a Tuesday afternoon when the bills come and the news is grim and the grandchildren are loud and the world feels like it is accelerating away from anything familiar, who sits in the cardiologist's waiting room next to a poster about heart-healthy foods and wonders if walking on a treadmill 3 times a week is enough and suspects it is not and does not know what else to do, whose cardiologist has never once spoken the words endothelium or nitric oxide, or beta endorphin, or Mu3 receptor during a 15-minute follow-up appointment, whose discharge summary mentioned ejection fraction and lipid panel and medication compliance, but contained no line about joy. That person's endothelium is still there, still 1 cell thick, still lining every vessel from the coronary arteries feeding the heart muscle to the arterioles in the fingertips to the capillaries behind the retina, still carrying the enzymatic machinery to synthesize nitric oxide from L-arginine, still expressing Mu3 receptors on its luminal surface, still capable of responding to the same endorphin signal that a genuine, body-shaking, tear-producing, stomach-aching laugh provokes. The machinery is intact. It has been intact since before the stent was placed. It is waiting for input. And here is something Berk demonstrated that reframes even the anticipation. The biology does not require the joke to land. His team showed that the mere knowledge that something funny is coming, the anticipation of a humorous event, produces measurable hormonal changes before the laughter begins. Cortisol starts to drop. Catecholamines begin to fall. The endocrine system begins preparing the vascular environment for the endorphin release that has not yet occurred. Your body starts the protective cascade before the first laugh. Forced laughter, the kind practiced in laughter yoga, produces some of the same diaphragmatic and vagal effects because the mechanical pathway does not ask for a reason. The diaphragm contracts regardless of whether the humor is genuine. The vagus nerve does not inquire why it is being stimulated. But the full endorphin release, the mu3 receptor cascade, the complete depth of the nitric oxide response appears to require authentic engagement. The two layers of the mechanism, mechanical and neurochemical, are independent but additive. The mechanical layer works with any laughter. The neurochemical layer needs the genuine article. This distinction matters. It means that the intervention with the greatest vascular potency is not a technique you perform. It is an experience you allow. The physiology works best when the laughter is real, when the humor catches you off guard, when the response is involuntary and total and leaves your abdominal muscles sore the next morning. Your grandmother told you to laugh more. Not your cardiologist, not the endothelial research community at the American College of Cardiology, not the psychoneuroimmunologists at Loma Linda. Your grandmother, or your mother, or the old family doctor who still made house calls 40 years ago and said things like laughter is the best medicine while writing a prescription on a paper pad, and never once cited a journal, and never needed to. She had no access to high-resolution brachial artery ultrasound. She could not measure flow-mediated vasodilation or assay gamma interferon or image mu3 receptor distribution on endothelial cell membranes. She observed what happened to people who laughed often and people who did not over decades, and drew a conclusion that 3 Nobel laureates and 40 years of vascular biology would eventually confirm at the molecular level. She was describing an endothelium-dependent vasodilation response mediated by pituitary beta-endorphin activation of mu3 opiate receptors coupled to constitutive endothelial nitric oxide synthase, producing a vascular effect equivalent in magnitude to aerobic exercise, sustained by simultaneous cortisol suppression, catecholamine withdrawal, immune upregulation through gamma interferon and natural killer cell activation, and parasympathetic vagal stimulation from rhythmic diaphragmatic contractions acting on the longest cranial nerve in the human body. She said it in 5 words. Tonight, find something that makes you laugh until your stomach hurts. Your endothelium will handle the rest.